Good morning. Thank you for joining us. Today we are going to be talking about what is vet school really like. So first we'll go ahead and introduce ourselves. My name is Nikki Lejeune. I am a third-year veterinary student here at Texas A&M. I graduated from Stephen F. Austin State University. My major was animal science, and I am from Houston, Texas.
And I am Emily Burkhart. I'm from Red Oak, Texas. And I got my BS in animal science at Abilene Christian University, and I'm a second-year student here at A&M Vet School.
And we are joined today by one of our professors. His name is Dr. Hoffman. Dr. Hoffman, could you tell us a little bit about yourself?
Sure. My name is Anton Hoffman, and I teach at the veterinary school in the professional program. Just a little bit about myself. I actually grew up in Victoria, Texas. Some of y'all may know where that is. I attended Texas A&M University as an undergraduate. Actually, my major was biochemistry. I was fortunate enough to enter the veterinary school here at A&M. I graduated in 1986, which was definitely before all y'all were born. I was in private practice for 2 years in San Antonio and decided to come back and pursue my love, which is teaching. Earned a PhD in 1992, and I've been on the faculty ever since. The courses that I teach in the professional program are primarily in the first year. As you guys probably know, veterinary school is a 4-year program. And in the first year, I teach gross anatomy in the fall semester, neuro anatomy in the spring semester. I also teach co-coordinate a course in the third year, which is an applied surgery course where I teach with one of the clinicians in the third year. So I get to see the first years 2 years down the road when they're in the third year of their curriculum. And also occasionally teach an undergraduate course as well. So that's kind of what I do. Nikki and Emily asked me this morning to talk a little bit about, from a professor's perspective, what makes a successful veterinary student. And I know that kind of the title for this morning is, what is vet school really like? How many of you guys think vet school's hard? Yeah, that's what everybody thinks, right? Everybody thinks vet school's really, really hard. And I like to tell my students that that's really a myth, in my opinion. I don't think vet school is hard. What is true is that vet school requires a tremendous amount of hard work. It takes a lot of time, it takes a lot of patience, it takes a lot of attention to detail, a lot of focus. It takes a lot of time, is what it takes. It's not really hard. I mean, quantum physics is hard, thermodynamics is hard, engineering, calculus, those are hard courses. I think most of our panel would agree that there's really nothing that difficult about veterinary school. There's just a lot of it, and it's really difficult to stay on top of it. And so Nikki had asked me to talk a little bit about, again, from my perspective as a professor primarily in the first year curriculum, some of the traits of successful veterinary students. And so I just kind of have a bulleted list that I wanted to go through quickly. Just again, from my perspective, different professors may have different viewpoints. But I think successful veterinary students from the get-go have to enjoy learning. And I know that sounds kind of trite, but I mean, you really have to enjoy the whys and the hows of what you're learning. They don't just come in and say, okay, tell me what I need to know, tell me the facts, I'll write it down, I'll memorize it, I'll pass the test, and I'll move on. They actually want to understand why things happen, what happens when things don't work properly. How am I going to use this 3 years down the road, 4 years down the road as a veterinarian? So they have what we call scientific curiosity. They like to learn. Secondly, successful veterinary students are very open to new ways of learning. Different professors teach with different styles. Some classes use a lot of case-based approaches. Some professors do a process which is called flipping the course, where students actually view the lectures ahead of time before a class, and classes are more for discussion. So I think they're very open to new learning styles. So important for veterinary students is the successful ones develop a study schedule. And again, we get back to that time issue. Veterinary students spend over 30 hours a week physically in class, either in lectures or in laboratories. And most veterinary students should spend between 20, 30, sometimes upwards of 35 hours a week outside of class studying. And so the successful students actually write out a weekly schedule, where they know, okay, Monday night I'm studying these two subjects. I'm going to spend 2 hours on anatomy, 2 hours on histology, for example. And then they stick to that study schedule, trying as best they can to stay caught up in all their courses. So they don't memorize for exams, they don't procrastinate, they don't cram for exams like I know all of us did when we were in high school and undergraduate. Also, veterinary students, successful ones, don't study by themselves all the time. Obviously, some of your study has to be by yourself, very independent study, to kind of get the the foundation material, but then the successful students will get together in small groups and throw around ideas and talk about difficult concepts maybe they're having trouble with. And so I think that's real important to study in small groups. I mentioned it earlier, but successful students don't procrastinate, they don't cram for exams. There's no way veterinary students can be successful, and I think these fine veterinary students next to me would agree with that. That just doesn't work in vet school. There's just too much material. You can't sit down the night before an exam and expect to cram all this material that you've had over the last 4 weeks in and be successful. Kind of getting away from academics, successful students also, I think it's very important, they schedule time for themselves away from veterinary school to do things that are important to them. If they have family, maybe a lot of our veterinary students are married or have significant others, to spend time doing things that kind of keep your mental health quota up. Go out to the movies, read books, go run, exercise, whatever, things that kind of keep them going mentally. And related to that, successful students also, I think, have really good health habits. They eat right, they sleep right, they get a good amount of sleep, they don't stay up late every night. Again, if you stick to a schedule, you don't have to do that every night. And they also exercise. A recent study came out just a couple of months ago where they looked at professional schools, medical schools, veterinary schools, dental schools, nursing schools, etc. And they showed a direct correlation between how physically fit a person is and how well they do academically. So there's a direct correlation between staying physically fit, which helps your mind be clear and alert for your classes, and your academic success. And last, I think successful veterinary students really focus on learning and understanding the material rather than so much the grades. The grades will come if you learn the material, but I think the successful students just try not to worry about, am I going to get an A or a B in this course? They worry about actually mastering and understanding the material, and then the grades will come after they've done that. They don't focus so much on the grades. Also, the last thing I think they want me to talk about is what did I do that helped me be successful in veterinary school? And really, to sum it up, is most of those things. Did I do it all the time? No. There were times when I procrastinated and I crammed for exams, and I always regretted it. I always regretted it.
Only ends in tears.
Yeah, because when you do that, if you drop everything and say, okay, I got to spend 2 days studying nothing but microbiology for this exam coming up. Well, yeah, maybe I passed the exam or maybe even made an A or a B, but then the next thing you know, once I'm done with that exam, now I'm behind in everything else, and the next exam is coming up next week. It just doesn't work. But most of those things I did. Most important for me was the study schedule. I developed a study schedule. I tried to stick to it as best I could to stay. You're never going to be caught up in veterinary school, but you want to stay as close to being caught up as possible as you go through the semester, and that prevents having to cram for exams.
I really like what Dr. Hoffman said, but I think also that can apply to you now before you go into undergrad or as you're entering undergrad. One of the hardest things for me as a first-year student was trying to develop all of those things while gaining all this new information. That was a lot of information, and so I had already built that schedule or that routine would have been really nice coming into vet school versus trying to build it while in vet school. Does that make sense?
Yeah, I would have to agree with Emily. My transition to vet school was really rough. Dr. Hoffman knows because we had to meet a couple of times to discuss my study habits. But it makes a world of difference. The difference between first year and second year for me was just immense because I found my study habits. I found that schedule. On Monday, Wednesday, Fridays, I did these 2 classes. Tuesday, Thursdays, I did these 2 classes, and so that really helped. So, Emily, if you'll go ahead and start us off what first year looks like, and Kim will switch to that PowerPoint slide for us.
So, first year is kind of a whirlwind, guys. It's you're excited to be here, and you're fresh on the meat on the platter, ready to go, and you get involved, you get in, and you get in hard. And I think Dr. Hoffman always gives really great advice that when you get here, you start with your feet running. If you don't start with your feet running, you're going to fall behind very quickly. And many of the things we're tested on throughout the year is from day one when we're sitting in class learning. Right? Am I right? Yeah. So fall we're going to have anatomy, which is small animal anatomy. If you get into vet school, you'll be offered a chance to take a workshop in the summer on anatomy, and I suggest you take it. Some people don't, and they do fine. I took it, and I did wonderful, and I didn't have to focus so much on anatomy as I did on my other classes, and it really gave me some more time to kind of get adjusted to vet school and what it was like in the workload. So then there's physiology, and physiology we learn a lot about why things are happening and how things are actually happening. So anatomy is more like what do you see, identify it, and physiology is what does it do and why does it need to do it. So if you took an anatomy physiology class in high school, that's very similar, but this will go into a lot more detail and a lot more depth. And if you really liked the question why, or you ever wanted to know why and how the body works, then I think you'll really enjoy physiology. Clinical correlates is a really cool class that is an introduction class, I think, to some more clinical skills, like how to diagnose or how to start thinking like a doctor. They like to say, like, we have baby doctor brains, and so we're trying to learn how to think like a doctor, and that includes reading the signalment, or what is the animal, what does it look like, how old is it, and then talking about the history of the illness. So when did it start, what does it look like, how long has it lasted, has it gotten any better, questions like that you hear your doctor ask you or your veterinarian ask you often. And then how to use all of that information and the signs that you see during your physical exam to diagnose the animal. And so we do a lot of research, and we have to type a big paper up, and it's really great. But besides the papers that we write in clinical correlates, they do a lot of hands-on skills like suturing or sewing wounds together. They do a lot of simulations that you don't get to do anywhere else. I mean, I think Texas A&M is pretty on the ball with the new technology about how to do simulations, and that's really cool.
Correlates is also really great because it gives you a chance to get hands-on experience with some species that maybe you've never interacted with before. So a lot of our students come in, they only have small animal experience, and so this is maybe the first time they've interacted with a horse or a cow or an ostrich. We got to take care of an ostrich named Z, and that was really cool. I'm terrified of ostriches.
No, Nova now.
It's Nova now?
No, you're not.
Yeah, so that was really, really terrifying. But it's really cool. It's just opening the doors to see maybe something you've never had an encounter with that maybe you would like to think about for your veterinary career.
And it's in a controlled experience, a controlled environment, and they also teach you how to do a physical exam on it. So you're getting hands-on experience, learning how to do a physical exam on these animals that you've never worked with before, and that's really cool, I think. So, yeah. And then there's histology, which is just microscopic anatomy, and so a lot of times with diseases, you have to understand what the cellular level looks like of the body. So you have gross anatomy with Dr. Hoffman, actually, and it tells you what the big organs are, what they look like, and the bones. But then you need to know what the cells of those organs look like, so that when you're talking about how a virus works or how bacteria works, you can understand what's the physiology and what the anatomy is happening, what's actually happening at that cellular level. So that's really important. And then there's immunology. Immunology is the study of your immune system, and it's all about white blood cells and antibodies and T cells, B cells. I've all probably heard of those if you're in high school. And it's about along those lines about how your body fights disease. And then finally, there's animal behavior. And I thought that class was really cool because I was actually training my puppy while I was taking that class. And if you don't know, puppies are wild and rambunctious. Don't get one your first year of vet school. Just a little bit of advice. And they like to pee all over my floor. And it's terrible. But I was learning a lot during my behavior class about animal behavior and how to train them and how to get them to do what I need her to do quickly and in an efficient and productive manner. And it actually really helped me a lot train my dog, and now she's fully trained and she's great. So.
And that was all your first semester. Are you tired yet?
And then there's the spring, and spring is busier, I think, than fall was. We have anatomy again, but this time anatomy is a large animal anatomy. So we cover things like the cow, the horse, the chicken, the goat, pig. All of those things we cover in anatomy during the spring. And then we have physiology, which is very much similar to the first semester of physiology, but you're continuing learning about the body. And then we have correlates again, and correlates has some ethic committee sessions, which are really cool. Some veterinarians from all over the state of Texas come and they sit with you for about, 4 hours probably, and you eat dinner together and you review some cases that were ethically questionable, and you talk about why and what you would do, and you'd actually be very surprised. Sometimes my initial reaction was right, but sometimes my initial reaction was very, very wrong, and I'm really glad that I got to talk to some veterinarians about what they do and what they would do in that situation, because otherwise I may make some mistakes that I could have avoided. So, and then there's also intro to public health, and public health is really important in veterinary medicine. If you don't know, your dogs are vaccinated for rabies to protect you from rabies, not necessarily your dogs. And so veterinarians vaccinate dogs for rabies all the time, And so we play a big part in your health as humans and as well as your pets. And so we talk a lot about public health, and that's really important. And then we have microbiology, and microbiology is the study of bacteria, viruses, and prions. It's a lot of memorization. It's a lot of information being put in your face and told you to learn it, and it's great because once you go out into the real world and practice in clinics, you can actually remember some of it, hopefully. And then there's embryology and neurology, which go together, and or neuroanatomy, I'm sorry. And
It's fine, you call neurology.
okay, embryology and neurology go together on the grade, but they're two separate classes, and they're both really interesting. Dr. Hoffman here teaches neurology, and it's wonderful, and he does a great job. And he shows you a picture at the beginning of the year, and you're like, what in the world? I'm never going to know all of that. And then by the end of the year, you're like, I know exactly what all of those things are. So he's a wonderful teacher. I'll be excited to have him. And then there's embryology. Embryology is the study of from egg and sperm to fertilization, all the way up through development in the womb to parturition. And so that's really, really important if you're going to be like a stem cell research, or you're going to do something along the lines of therionology. All of those things are going to play a vital role, but also in like maybe even neonatal defects or congenital defects. Understanding the development of the embryo and the fetus is really important in understanding what you're seeing in the neonate or the baby animal, and why it's happened or why it's occurred. So that's first year in a nutshell.
Very, very big nutshell. All right, well then, since I just completed second year, I wanted to tell you all about those classes. So you start the fall with all of the P classes: pathology, pharmacology, parasitology, as well as another clinical correlates, nutrition, and also an option to take a communications elective. So for pathology, that is an opportunity to learn about the different body systems and the organs and what they look like in a normal individual, as well as what they'll look like when they're diseased or in an abnormal individual. That way, when you are taking biopsies or looking at different diagnostic procedures, you can see, okay, this organ is normal, there's nothing wrong, or this system has a lot of problems with it, we need to look further. Pharmacology is the study of all of the different medical drugs that we use. That class is pretty difficult for a lot of people. It's a lot of drug names, and we have to learn how the drugs work and what they're used to treat. So it's really important, but it's just kind of overwhelming at times because you're like, oh, there's so many options to choose from. Parasitology was probably one of my least favorite classes because it's kind of icky. You're talking about all of the different bugs and critters that it's icky. You're learning about all the different parasites that are in animals and what they do and what they look like and their life cycles. And so that's, again, a lot of information, like Dr. Hoffman was saying. Nothing really complicated, but you have to know each of the different organisms and each of their different life cycles so that you can accurately diagnose and treat an animal for them. We have another clinical correlates semester, which looks a lot like your first year clinical correlates. Again, it's just more hands-on experience. Learning how to give vaccinations and draw blood and really practical things that you need for your everyday veterinary career. Then we have nutrition. That one I really liked because we talked about large animal and small animal nutrition, and that was information that I could take home and start using immediately. I found out I was feeding my cat the wrong food. She's 18 years old, and I didn't realize that her protein protein requirements were so high, so I ran home and I was like, Mom, we have to change her food immediately. So she didn't like that very much. But and then we also have the option for a communications elective. So this is a 1-hour course that you can take either in the fall or the spring semester, and this is just an opportunity to learn how to relate to clients better. So a lot of vet schools learning how to work with the animals, but animals need people to bring them to the vet clinic, so it's really important that we're able to deal with the people that own them. And that's one of my favorite aspects of veterinary medicine, so I took that elective and I really liked it. We drive over to A&M's medical school, and they actually have simulation doctor's offices set up. So it looks like you're walking into a doctor's office, and they put a stuffed animal on the table, and there's an actor in the room with you. And you walk in your white coat with your clipboard, and you introduce yourself as like, hello, I'm Dr. Lejeune. And you take a history, and you pretend to do a physical exam, and you just learn how to interact with them. So that was a really neat opportunity because some of them were situations that I didn't even think about. Like what happens if your client is handicapped in some way, either a physical disability or a mental disability. And so it was really interesting learning how to overcome those obstacles and feel comfortable in the exam room with them. So that's what your fall looks like second year. This is a lot of information, so bear with us. Your spring, again, you're going to continue pathology, and this will actually move from learning about the systems to what we call clinical pathology. So when your veterinarian takes a blood sample and runs it through a machine and you get a printout and they're like, oh, this animal has this. That's what we're learning. We're learning how to read all of these different diagnostic printouts and these different mechanisms. Pharmacology, again, you are learning a little bit more about drugs, but also how to read scientific papers so that you can analyze drug efficacy. So you can constantly be learning and educating yourself on, is this the best drug option, or is there a better drug option for the disease that I'm trying to treat? Toxicology is another one of those. It's just a bear of a class. There's a lot of information, and on top of learning about what the plants do and how they affect an animal, you have to be able to identify that plant. So you need to be able to walk into a farmer's pasture and say, oh, your cattle are getting sick because they're eating this plant. I know what this plant is and I know how to treat it. So that was a very interesting class. We also have infectious disease, and that one kind of goes hand in hand with public health. We're learning about the different diseases that not only affect animals, that can also affect us, and how to best prevent those as well as treat them. We have public health, and so that is just, we're learning about statistics of disease outbreaks and, again, prevention and treatment, because the prevention is just as important, if not more important, than the treatment itself. We have anesthesia and surgery, so this is sort of a vet student's first opportunity to encounter what surgery and anesthesia will look like, and it's really fun. We get to put animals under anesthesia so that we can learn how to do procedures on them and learn how the anesthesia machine works and how we're breathing for the animal and monitoring heart rate and stuff, and learning how to do sutures for surgery, because in third year we actually start doing live surgeries. And then last but certainly not least is radiology. So now we're learning how to read x-rays, which the actual term in veterinary medicine or in any medicine is a radiograph. X-rays are the energy, the waves that produce the picture, which is the radiograph. And so that class is surprisingly difficult. You think, oh, it's only a 1 hour class, it's going to be easy, but it is certainly not. And it's a really it's a foundation for, I believe, diagnostic tools for veterinary medicine, because if you can figure out from a radiograph if something is normal or abnormal, it really helps. So that is second year all done. Now we could not get any people who had completed third year, because fourth year is actually from May to May. So all of the people who just finished third year are now fourth year students. So you'll have to be okay with me explaining it. But third year, classes look a little bit different. This is sort of a hybrid year. You're spending most of your time in the lecture hall, but then you spend a lot of time in the clinics as well, and you sort of get to start to create your own schedule third year. So you start with large animal medicine and small animal medicine. These are sort of broad classes where you're starting to learn what these diseases are and how you can diagnose them, and it's really cool. Kim, I'm actually going to need you to throw that slide back up because I didn't write these down. So in addition to the small animal and large animal medicine, you have radiology. So I just talked about second year, you take a 1 hour radiology. This is like a big kid radiology class. You're learning, it's the real radiology class where you have to be able to look at these radiographs and diagnose, not only broken bones or fractures, but you also have to be able to see if organs are in their right positions, because you can not only see bones on radiographs, you can also see soft tissues. There's just a lot of stuff that goes with radiology, and so it's a really important class. You also do surgery. So you start doing surgeries on different species. We do dogs and goats, so we'll actually get dogs from a shelter and spay and neuter them, and it's really, really cool. You start going into the clinics, and clinics are really fun. You start to get to meet the clinicians that you'll be working with your fourth year and really see where it is that you fit in your veterinary career. Some people go into the clinics, they love small animal medicine, that's all they want to do. Some people go into a small animal clinic and think, that's really not for me, and they really click with their large animal clinics. Then you also get electives. So on top of these classes that you're taking, you get to pick classes outside of those. So we have things like cardiology, clinical pathology, which was the class that you took second year, herd health, equine colic team, and there's so many others. There's like 30 or 35 electives that you can pick from, and really it's just a curriculum du jour. You get to pick what it is that you're really interested in and have an opportunity to see what it is that you want to do for the rest of your career. See things that you maybe aren't very good at but you want to get better at. Like, I'm not very good at cardiology, so I'm taking that elective so I can beef up my heart skills so that when I'm having to read EKGs and look at heart diagnostics of animals, I can better understand what's actually going on in that animal. So lots to choose from there. 3VM, third year is really, really cool. And then there's fourth year, the holy grail of vet school. And fourth year, like I mentioned, is a full year. It's from May to May, so it's kind of hardcore. You have 52 weeks, and every 2 weeks you're on a different elective. You do get a vacation in there, and you get either Christmas or spring break off, but there's a lot going on. Yeah, you don't get a whole lot of a break, but you get a little bit of a break. And there's 5 different tracks you can do. There's small animal, large animal, exotic, mixed, and alternative. So these are just some examples of some of the rotations. They are not by any means all of the rotations. There are a whole lot. In small animal, you're spending most of your time in the small animal clinic, but you're also spending a little time in the large animal clinic because they want you to be well prepared for any sort of veterinary medicine you go into. Whether you graduate thinking, oh, I wanted to do small, and you go into large, you can do that because you've had enough knowledge in all of the areas. And if you really, really want to do exotic, and for some reason you think, actually I really like horses, then you have the skills that you can to switch between the fields. And then alternative, because we can only do so much here at the vet hospital, if there's something else that you want to do, say you want to pursue a career in government, maybe you want to use your DVM for something other than just clinical medicine, you can pick an alternative career track. And those are rotations. You still have the same number of rotations, but you get to actually pick where these are, whether you do them here at A&M or do them off campus. So if you want to spend 8 weeks at the CDC learning about epidemiology and how to track virus outbreaks like Ebola, you can go and do that. The alternative career gives you that opportunity. Okay, so we just went through 4 years of vet school. All right, that was really quick. And next, we are going to go to questions. So Kim, if you can pull those up and read us a few of those, that would be great.
Okay, so we have the question, what is the TDCJ?
Oh, awesome. So Dr. Hoffman's Texas Department of
Criminal Justice.
And what that
Prison
is.
system.
Prison system. Fourth year, you go to prison.
Yeah.
So during the fourth year, yeah, it is. It's the prison system. So some of the prisons here in Texas actually are trying to become self-sustainable. So not only are they producing their own crops, they're also producing their own animals. And so they are in need of veterinary care, just like any other animal. So we do send some students to the prisons, and they take care of those animals. And it's really cool. People fight over these. Like, I really want to do it. I want to do it so bad.
I'm going with Dr. Dominguez.
Yeah, Dr. Dominguez. Oh, you are?
Mm-hmm.
Oh, that's really cool. We have several professors that are food animal professors, and they lead those, and they're really cool. And it's very safe. They wouldn't take us anywhere that wasn't safe. And so it's one of those really cool hands-on experiences where you get to work cattle. So that's what that is. I hope I answered that question.
And many times these inmates, like, they value the animals because they've been taking care of them and they know how much hard work has gone into them. So they want to see them get the proper health care. And so when you talk about safety, it's very safe, and you have a professor there with you at all times. So.
Yeah.
And you have a warden.
And a warden.
And actually, we have a funny story about that. So when we go on these rotations during the really, really cold months, you're outside. And at a certain temperature, the inmates are not legally allowed to be outside because that's considered abuse or neglect or something. So they pull the inmates back into the prison, but the vet students still have to be there to work on the animals. So the vet students are out there with some of the, what are they called? Not the wardens, the security people, the guards, thank you. The prison guards will actually stand out there and help the vet students, but the inmates aren't allowed to be outside. So, next question, Kim.
Okay, someone's asking, how do you recommend taking notes?
Ooh, Emily, how do you feel about note taking?
You can't write fast enough. That's the moral of the story is you can't write fast enough, and I'm not kidding, you really can't. I know several people who try and write the notes, but just they quit halfway through the lecture because they've fallen so far behind. So I would suggest you get a good computer or a good laptop, and you get accustomed to while you're an undergrad. Go ahead and typing your notes. And I don't really learn from typing very well, and so that was a struggle for me first year. But what I would do is I would then print those notes, and when I was studying them, I'd go back and highlight, underline, circle, rewrite, whatever I had to do to get it in my head. That way I had had the notes I needed on my computer, but I was able to go back and do the things that were mnemonic for myself that would help me for the test. And then also, I know some people record lectures. I also know some people don't take notes, but I would suggest that you don't do that at all, ever.
Yeah, I tried to convince myself, well, if I just pay attention and I look at the professor during the lecture, I'll learn so much more. That's a really bad idea. A lot of students have iPads, and it's an easy portable way to take their notes around. That way they have them all the time. And they'll download certain apps that help with editing, so they can highlight, they can write, they can delete, they can add. I personally like to do handwritten notes a lot better, and what the professors do a lot of times is they'll they'll create a note packet for us that we can go down in our basement. We have printing services, and we'll actually print those out and get them bound, and that way you can bring the notes to class. That way, as the professor is talking, a lot of their notes are already written for you, and you can just go in and add, like, oh, this is what Dr. Hoffman meant when he said this, or this is what Dr. Washburn meant when she said this.
And there are definitely some classes that I would suggest you get at with. Like neuro, for example, was a great class because you could draw the neurons on the paper while you were learning it. But then there are other classes that I would suggest that, like, just taking notes on the PowerPoints they give you while they're giving you the presentation helped me tremendously to know what, number one, was important, but number two, what they were emphasizing.
Right.
And so that was really, I think that's a big deal. It's just knowing the teacher and knowing the class and knowing yourself and how you study. That's most important.
And that's something I did in college. A lot of the professors posted their PowerPoints online, and so I would print out those PowerPoints and bring them to class. That way I already had, you want to make your job as easy as possible. If you have some sort of information they've given you, print it out. That way all that you have to do is do the extra stuff. Sometimes, not always, they like to be a little sneaky, and they'll mention something in class that wasn't in their notes, and it's important for the test. And so it's nice for you to already have a framework of notes, and that way when they say something that wasn't in the notes, you can go, ooh, I need to write that down. And you can highlight and all that stuff. So that was a really good question.
Jason, is your?
Yeah, also every class is different, every professor is different, but fortunately I think the veterinary school now, almost all the instructors actually record their lecture.
Yes.
So there's an audio recording of the actual lecture that goes along with the PowerPoint that the students can go back and look at any time. So if you miss something, it's not a big deal.
Mm-hmm. Or if you're sick.
Or if you're sick, or if you miss class. And I'll age myself. When I was in veterinary school, there were no such thing as these things called computers. There were no iPads, there were no laptops, there was no Camtasia.
Did you have a chalk
there
and
were
slate?
no PowerPoints. It was overheads and chalkboard for the instructors. Everything was on an overhead. I don't know if y'all know what an overhead projector is, where they have a transparency that they would draw on or write on. Yeah, or at the chalkboard. And the way that we took notes, and none of the professors gave us bound notes ahead of time, so you showed up with a spiral, blank paper, and a pencil or a pen, and take notes. And so when I was in school, I would take as best of notes as I could. There's really nothing to go back and reference, but then that night, that was part of my study schedule, is I would go through each class for the day and quickly rewrite and organize and outline the notes. And that was my study time. That was how I studied, was actually rewriting the notes, trying to figure out what was important, what wasn't important, or if there was something that I missed and I didn't understand, I could get out the textbook, read that chapter, try to get that concept down.
And also, if you're like tempting when you're an undergrad to not buy textbooks, and I suggest that you don't do that either. I've actually kept many of my textbooks, and I refer to them all the time when I have a concept. And I know that I learned it before, but I can't remember it. I'll refer back to my textbook, and I will probably keep them for the rest of my career on a bookshelf somewhere where they'll dust until I need them. So.
All right, Kim, I think we're ready for our next question.
Okay, we've had several questions about the hands-on experience you get. So we'd like to talk about when we go into Portal and we have to put in all the skills that we learned.
Oh yeah,
That's
that's a really good idea.
Core
Thanks, Kim.
The core
competencies.
Yeah. So by the time you graduate, you're supposed to have how many of those?
It differs. So they
I think
have
that's
different
different.
categories. There's like 6 or 7. So you have, Dr. Hoffman, you might be able to better
It's
explain
like
it.
1,200.
I think it's 1,200.
It's around 1,200 things that you have to have done, physically
Yes,
done with
yes.
your hands.
So basically, in order to be accredited by the AAVMA, right? That's AAVMA. Yes. AVMA.
American Vet Med
Yes.
Association.
In order to be accredited, the university has to require that we hit so many hands-on experiences before we graduate. So when we go out into the real world, we actually have some kind of idea of how to do these things that are pretty applicable to everyday clinics. Every year you get some done. I know I got probably like 20 done this year as a first year. So that's a lot if you think about it for a first year. I mean, you'll get most of them 4th year when you're in rotations, but you can log many of them, and they can include anything from talking to a client about nutrition for their cat or their dog. It could be giving an IV catheter. It could be suture skills. It can be all kinds of different techniques that you do with your hands. Those are just a few examples. Oh, physical exam, performing a physical exam or a neuro exam on an animal. Those are all examples of things that I logged this year alone as a first-year student. I know Nikki probably has many more that she's logged.
I am really bad at logging them, so
Yes, most students are.
So we get a lot of opportunities, and a lot of students, one of their complaints is that we don't get enough hands-on experience, but that's really just because there's so much for us to learn and so little time. So a lot of us will spend summers and winter breaks going home and working at the vet clinics that we've sort of grown up at. And that's another really great place to get hands-on experience. I got to intubate a dog under the supervision of the veterinarian I was working at, and that was like, I was on cloud 9 all day. I just walked around and I was like, I intubated a dog.
I gave an IV catheter to a cow the other day, and I just...
Yes, we get this is what we're excited about. And so, yeah, they try to give us as much hands-on experience, and A&M's really cool. We get more than a lot of universities do, but it never feels like enough. And so that's one of those things where, as you're in high school and undergrad, try to be finding opportunities to go work with veterinarians, establish those connections, so that when you're getting closer to your final days in vet school, you have someone to come back to say, hey, I'd really love to come and work with you. And if they trust you, they're going to let you do some really cool things.
I also know people who went ahead and got their vet tech license while they were in undergrad, which is it's wise. It's a lot of work. It's difficult to do while you're studying. But if you're just ambitious enough and you really want to do it, they actually teach you how to do a lot of these things. And when you're working at a clinic, you can be getting that hands-on experience because you know how to do it. And it also looks really good on your resume and application to vet school. So.
Okay, Kim?
Do you want to talk about majors in undergrad?
Yeah, we can do that a little bit. Emily and I are kind of unique. We're both animal science. Normally there's a little bit more of a mix, but probably the top 3 majors that veterinary students have is biomedical science, which is an A&M major. But that's the biomedical sciences is with the College of Veterinary Medicine, and that's really for anybody who wants to do pre-health related. So doctor, dentist, veterinarian, optometrist, any of those things. A lot of those students will choose biomedical science. I personally chose animal science because I wanted the hands-on experience. I didn't grow up with livestock, but it's something that I'm really excited about in the veterinary medicine field. And so I really wanted more experience with those animals. So I picked animal science, and I picked a smaller school. I didn't want to go to A&M. Loved the Aggie spirit, but it was a little bit overwhelming for me. So I chose a smaller school like SFA so that I could get more opportunity for hands-on. So instead of labs of 300, I was in a lab of 30. And my professor made us do the things before we were allowed to leave lab. And if you didn't want to do it, you had to hide in the corner and sneak out. So we got to do branding and ear notching piglets, and
we did the palpation.
Yeah, we got to palpate. That was really cool.
Pregnancy.
Yeah. Dr. Hoffman, you said you were a biochemist?
That's biochemistry.
Okay.
It's not real common. I'm also on the selections committee, so I kind of have a little knowledge of what our undergraduate majors are, and without a doubt, as Nikki said, most of our students are some sort of biomedical science major. Also, biology is a very common, just a kind of overall broad biology, or zoology, animal science, as Nikki mentioned, is very common. I think zoology, chemistry, we have a fair number of chemistry. And we also have a lot of what we call, well, not a lot, we have a fair number of our veterinary students that are what we call second career people. Where maybe whenever they went to college after high school, decided they wanted to be an engineer or a journalist
or a lawyer.
Or a lawyer, right? Yeah.
One of my best friends is a second year with me, and she got her whole entire degree in accounting. So
it's not at all uncommon for us to have undergraduates where we look at their major and it's like engineering or journalism or psychology
or English
or
something random.
Sociology, things that you would think, why are they doing that? And it's just because they changed their mind. Maybe they changed their mind while they were in college. Some people are truly second career where they've got their undergraduate degree, say in engineering or in psychology or law, and they've gone on and they've had a 10 or 15 year career doing that in that profession. Then they kind of have a change of heart and say, I think I want to be a veterinarian. and they can go back and take what are called prerequisite courses. Those are just required courses to be qualified to apply to veterinary school. They get those courses done, they take them, and then apply to vet school. And oftentimes they're successful, they get in, and we have never had a medical doctor change careers to veterinary medicine, but we've had a couple of lawyers, attorneys, that are still licensed attorneys
PTs.
that have come through, physical therapists. Definitely, we've had a journalist that was not an author, but a newspaper writer.
So you can be a veterinarian, I mean, you can come back and choose to be a veterinarian even after you graduate with a different degree, as long as you take your prereqs.
I forgot one. One of our veterinarians here in town, I still remember because I interviewed him many, many years ago. He was a he was actually a geophysicist, and he gave up a very large six-figure salary
I
to
bet
come
he
back
did.
to be a veterinarian. He currently owns one of the practices here locally. He's a good story.
All right, I think we have probably time for one more question before we need to close.
Okay, do y'all mind talking about the interview process a little bit? I know we're different than most schools.
Oh, MMIs.
Yeah, definitely, especially with Dr. Hoffman here.
Yeah, so MMIs are just multiple mini interviews, and it just means that instead of going and sitting in a room with 4 people and talking to them for about an hour about yourself or however long it takes, you actually walk into 10 different rooms, and you're only in there for 6 minutes? There's 6
I think
minutes,
it's
12.
It's
6
6 rooms.
6 rooms.
And you have
6 minutes.
6
6
minutes.
minutes.
That's what it is.
Yes.
6 rooms for 6 minutes, and you sit down and they have different scenarios that you have to address, and they give you a list of questions that you may want to answer while you're sitting in there. And then if you finish early, they can even prompt you with some more questions about that particular scenario. I don't know. Can you give an example scenario that's not one that you use often?
No, I can't.
If we did, we'd have to kill you.
Yeah.
Yeah.
Okay.
But they ask me questions.
Those are very protected because we don't want our applicants to know ahead of time we want them to think on their feet. But yeah, it's basically speed dating.
Yeah.
Is
Yeah,
what
it
it is. The reason we do it is because it is much more fair to each of the individual applicants. It is much less subjective and it's much more objective. Again, it's much more fair. Because, for example, let's say that you're applying to vet school and it's interview day, and maybe you go to your first scenario. You have 2 minutes to read the scenario. They're very short, a couple of prompting questions. The timer goes off. You walk in the room. You meet the 2 faculty members or veterinarians that are in the room. You sit down and you have 6 minutes to address that scenario. And then once you're done, you step out, you have 2 minutes to kind of catch your breath, and you move to the next station. So it's all
collecting
done.
your zen.
Yeah, so it's all done
Collecting
over
your
an hour
brain.
period.
Yeah, that's
But let's say, for example, you walk in and just for whatever reason, maybe it's nerves, maybe it's a scenario that you're not real comfortable with, and you just don't do very well. And you know you didn't do very well. Well, you know what? Whenever that timer goes off, you can walk out, you have that 2 minutes of zen time to collect your wits, kind of take a few deep breaths and say, you know what, the next room I'm going into, they have no idea what I just did in that last room. And so I have a fresh start. And so I think it is much, much more fair. And we've been doing this this is going to be our 4th year that we've done the MMIs, and I think it's a very positive change that we've done versus the old. Because the old way, yeah, you may have 30 minutes or an hour where you're with 2 or 3 people, and if it goes south and you're not doing well, your whole interview didn't go well.
Well, and I think everyone has that one room that they just were like, shake it off. You know, I mean, there's one
I
room
left the
that
whole
it's like,
interview. I cried all the way home. I thought it was awful, but
it worked. It worked.
Apparently not.
I have one question.
Yeah, Dr. Johnson.
You guys mentioned what you did during the school year. What do vet students do in the summertime?
This.
Anything. It can be such a huge difference. You can go to an externship or an internship. You can go work at a vet clinic or volunteer at a clinic. Or you can be part of the peer program or work at the university. What we do actually is teach young students from K through 12 about veterinary medicine and different topics about veterinary medicine. And there are people who work at the vet school help TA undergrad classes and things like that.
Research.
Yeah,
Research.
mission trips. I have several friends that are going to Nicaragua and Honduras. There are educational programs. A couple of our students are in Germany this summer learning about different, like the history of veterinary medicine and how it looks all over the world. And some students are in Italy doing like a food health safety program, an international food safety system. So it's really cool. All right, so before we close, you can go to peer.tamu.edu. That's what our homepage looks like. We've pulled down the videos tab for you. There are several options. We have interviews, so you can hear more veterinary student stories of how we got here, what we did to prepare ourselves for vet school, and some stories of us in vet school. We also have video conference recordings, so if you missed us last week on the admissions process, you can go check out that video. It's got some really good information on it about what we did personally, as well as just general information about the application. Also, that next slide is going to show you, we have a tour of the vet school. So if you're thinking, I kind of maybe want to be a vet, but I don't really know what vet school really looks like, you can actually have a tour of the vet school. We have a short and a long version, and you can see a little bit more about where it is that we do all of these wonderful things that we've just shared with you. So thank you guys for joining us today. We really appreciate it, and we'll see you next time.